Well, about 15% of Americans are covered by Medicare. And if you are on Medicare, you'll want to take note of open enrollment. It's currently on until December 7th. Now, this is your time to review your plan, think about your coverage, and shop for plans that best meet your needs and your budget. In this edition of Senior Source, we walk you through what you need to know about Medicare and open enrollment. Kim Latta is here. She is with the State Health Insurance Assistant Program Director for Colorado. Thank you for stopping in and helping us with this today.
Thank you for having me.
So for people unfamiliar with the program, can you explain what Medicare is?
Right. Medicare is a federal health insurance program for people age 65 and older and some younger individuals with disability.
Okay, and what is the annual open Medicare enrollment?
So as you mentioned, this is their time to review their coverage and make sure it still is a good fit for them in 2019.
And so it's happening now until December 7th?
It is, and any changes they make now would be effective January 1st.
Okay, so the changes, I just want to make sure I get that right. So the changes that they make now takes effect January 1st?
Yes.
All right, and if you want to find out more, there's a website at the bottom of the screen. You can go to Medicare.gov, Medicare.gov. Does everyone need to pick a plan for 2019?
No, if they like their current coverage, it's fine to keep it. They won't have to do anything, but it's important that they review any changes that will be made to their current plan. They'll get that notice from their current insurance company.
Why do you think it's important for Medicare beneficiaries to review their changes?
Because changes are made from year to year on what you pay for those plans, the provider network you can use, and the formulary, which is the list of drugs that are covered. So things might have changed in your life, and things might change to those plans. So making sure it's still a really good fit. And although money is not the primary concern, sometimes people can save money by making a change.
Oh, that's great. Let me give out a phone number too. The website, again, you can go to Medicare.gov, but if you'd like more information, we do have a phone number right there at the bottom of the screen. It's 888-696-7213. You can call and ask any question that you would like. And talk about if people change their plans. Do they log on to the website? Do they log on to Medicare.gov? How do they change their plans?
So they can do it themselves by going to Medicare.gov and using a tool that's there for them to compare the policies that'll be available in 2019. If you need assistance, there is a federally funded assistance program, Medicare counseling program called SHIP, State Health Insurance Assistance Program. You can call that phone number and a Medicare counselor will help you.
And that's the 888 number I gave earlier.
Yes.
Okay, thank goodness you're here. There is so much to this to understand. And besides the enrollment, is there anything else that Medicare beneficiaries should be paying attention to right now?
So if you were on Medicare prior to April of this year, you are now receiving a replacement Medicare card with a new Medicare number. So look in your mailbox for that card. They changed the number because the number that was on the old card was based on a Social Security number. So if you lost that card, there was a chance someone could steal your identity.
Oh, gotcha. And why, so that's the reason why they came up with the new card?
Yes.
Okay, so that's why all the changes, and there it is on the screen right now, so make sure you're looking for that. If I have received the new card, should I start using it right away?
Absolutely. Not everybody uses their Medicare card when they go to the doctor, but if you do, this is the new card that should be used. And once you get it and use it and everything works well, you should shred your old card to protect the personal information on it.
Get rid of it. Yes, shred it.
Right.
Make sure you do. Cut it up. Don't just cut it in two.
No.
Make sure you shred it, pretty much is a good word.
And if you don't use that card when you go to the doctor, you should still keep that card and put it in a safe place and destroy your old card.
Okay.
If you have a Medicare Advantage program, you probably use that plans card when you go to the doctor, but still hang on to this new Medicare card.
What if they haven't received the card yet?
So the cards have been mailing in Colorado for about 6 weeks. It'll take another month for all the cards to get mailed. So I would say at the end of November, if you haven't seen your new card, you should call 1-800-MEDICARE and tell them you don't have your new card.
Gotcha. A lot of valuable information. Thank you so much. All right, again, open enrollment for Medicare is on now through December 7th. What are you waiting for? Log on to Medicare.gov, Medicare.gov for more information about reviewing and selecting a new plan. If you need assistance here in Colorado, call the State Health Insurance Assistant Programs, or SHIP, at 888-696-7213. That's 888-696-7213. Don't forget, if you have Medicare, you will be receiving a new card. If you haven't received it by the end of November, call 1-800-MEDICARE to report it, and make sure the Social Security Administration has your current address. Once again, you just have to go to Medicare.gov for more information.